Hello, and thank you for allowing us here at Mountain View Hospital to care for you and your newborn baby. In this video, we will go over discharge instructions and important safety information for both mother and baby. All of these instructions will be printed out for you at discharge for further reference. Let's start with newborn care. Prior to leaving the hospital, all newborns must have a car seat unless you are taking public transportation. If you are taking an Uber or a Lyft, you will still need a car seat. Please be sure you read through the instructions on your car seat prior to discharge from the hospital. There are many different styles of car seats available. For the first 2 years, your newborn requires a rear-facing car seat. This can be a car seat with a base or a convertible car seat that will grow with your baby. If you have a car seat with a base, please make sure that your support person brings the car seat to your room but leaves the base installed in the vehicle you will be going home in. The base must be installed prior to discharge. If you have a convertible car seat, do not bring it to the room. Please have it installed in the vehicle prior to discharge, adjusted appropriately for your newborn. Your baby will be secured and transported in their car seat. Someone from the care team will escort you down to the main entrance. Please ask your driver to text you when they are curbside. Please be sure to review your car seat manufacturer's instruction manual, visit the manufacturer's website, and review your vehicle's instruction manual to become familiar with your newborn's car seat and base installation. It is your responsibility as the parent to know how to use your car seat prior to discharge. We are unable to install your car seat and/or base for you. Lastly, if you would like information on car seat checks, please visit safekidsclarkcounty.org/events to find an event near you. When choosing an outfit for your newborn to go home in, please make sure to consider the weather. Dress your infant as you would yourself. It is important to prevent overheating your newborn, especially in the hot summer months. For warmth, best practice is to layer newborn clothing rather than using numerous blankets or other coverings. In the colder months, you may want to bundle your child up. However, it is not recommended for children to have large jackets or puffy suits on when strapping them into the car seat, as this leaves extra space between them and the straps that can be harmful in a crash. We recommend that everyone have a blanket for their newborn for discharge. Once your newborn is strapped in securely, you may place the blanket either over top of the car seat or lay the blanket over your newborn. Please do not put blankets underneath your baby. Now let's talk about safe sleep. The American Academy of Pediatrics recommends that newborns are placed alone, on their back, and in a crib or bassinet, the ABCs. This best practice reduces your baby's risk of sudden infant death syndrome, or SIDS. Bed sharing is not recommended. Please do not put pillows, bumpers, toys, or puffy blankets in cribs or bassinets, or use any type of inclined sleeping positioners. Sitting devices such as car seats, strollers, infant carriers, and swings are also not recommended for routine sleep, especially for infants younger than 4 months old. They do not have the neck strength to keep their airway open if blocked. It is okay to swaddle your baby for sleep, but swaddling over the arm should be discontinued when your baby starts to roll over. Let's go over how to safely use the bulb syringe. The bulb syringe that is given to you here in the hospital should be kept near the baby at all times in case of sudden choking. To begin, pinch the bulb away from the baby to squeeze out the air. When suctioning the mouth, place the tip of the syringe towards the inside of your baby's cheek, not the back of the throat. Release the bulb, which will draw up the fluid. On a towel or blanket, clear the syringe and repeat until your baby's mouth is clear. If needed, move to the nose. If both the mouth and the nose need to be suctioned, suction the mouth first. It is important because newborns may gasp when the nose is suctioned first, causing them to aspirate the mucus or fluid in the mouth back in their airway, making the problem worse. It is also important to refrain from suctioning the nose with the bulb syringe too often. There are very soft mucous membranes in the nose that will get irritated if contacted too much. This will cause newborns to sound congested, when in reality, the mucous membranes of the nose are swollen due to continued irritation. Only use in the nose if you see secretions. Now we will move on to your newborn's behavior, diet, and what to expect when it comes to diaper changes. It is normal for babies to cry. Newborns usually cry for 3 main reasons. They're hungry, they need to burp, or they're wet or dirty. To soothe your newborn, start by checking to see if a diaper change is needed. If your newborn just ate, place the baby over your shoulder or upright on your lap and gently pat or rub their back or tummy. If these techniques do not work, you could try walking with your baby, rocking your baby, or even giving your baby a pacifier. Sometimes it can become overwhelming when you've checked all of these boxes and your newborn still will not settle. It is never, ever okay to shake your newborn. If you feel overwhelmed and are alone, place your baby in a safe place like a crib or a bassinet and walk away. Take some deep breaths, call a family member or a friend, and allow yourself to decompress before trying to soothe your baby again. Now let's talk about baby feedings. If breastfeeding, your infant should be eating around 8 to 12 times per day, which equates to roughly every 2 to 3 hours. If formula feeding, your newborn will generally take 1 to 2 ounces per feeding, and this will increase with time as baby's stomach grows. Formula-fed newborns should eat every 3 to 4 hours. These are generalized times, and your baby may wish to feed sooner, and that is okay, so long as baby is tolerating feeds and not spitting up the majority of what is consumed. If you are breast and bottle feeding, you should be breastfeeding first, offering both breasts, and then follow up with formula. Baby should have a minimum of 8 feeds a day. Your baby is no longer hooked to the food source, which is you. You may need to wake your newborn to feed for the first few days. It is important that baby gets enough feedings in order to gain weight. Underdressing your newborn or changing a diaper may do the trick to wake them up for a feeding. Your baby does not need anything else besides breast milk or formula. No water or solid foods until your pediatrician tells you. Please ask your pediatrician if you have further questions about feeding. Let's go over wet and dirty diapers. 1 to 2 wet diapers are normal for the first day or 2 of life. A good rule of thumb is for the first week of life, however many days old your baby is, that is the minimum number of wet and dirty diapers they should have. It is a good idea to keep track of your baby's feedings and diaper changes in case of questions regarding weight gain and jaundice after discharge. Over the next few days, your newborn's bowel movements will begin to change from the thick, black, sticky tar-like meconium to a mustard yellow color and become softer in consistency. When changing your baby, they should always be wiped from front to back. This is especially true for baby girls to avoid urinary tract infections. Be sure to clean all creases and folds to prevent diaper rash. You may notice that your baby girl has white or pink discharge from the vaginal area. These secretions are due to hormones passed along from mom and will gradually disappear. If you would like your baby boy circumcised, your pediatrician will discuss this process with you. Newborns should be sponge bathed only until the umbilical cord stump falls off, generally within the first 2 weeks of birth. Once the stump falls off, you may submerge the area in a baby bathtub. When sponge bathing, use a soft washcloth and plain water only to wash your newborn's face, and a mild infant soap on the body. It is important to keep the cord clean and dry and to inspect the area with each diaper change. If any redness, drainage, or discoloration around the area is noticed, please notify your pediatrician. Newborn rash and melia are common newborn skin conditions and generally disappear on their own. Now let's talk about testing and follow-up care. Jaundice is common in newborns due to their immature livers. We have checked your baby's jaundice level either through the skin or blood test, depending on your pediatrician's preference. The result will be listed in your discharge instruction packet. Please note, if your baby appears more yellow in the next 24 hours, please notify your pediatrician immediately. If you have chosen for your baby to receive the hepatitis B vaccine, the hospital will forward the vaccine administration information automatically to the Nevada WebIZ immunization program. We do not provide physical cards. You may request immunization records directly from WebIZ or from your pediatrician. When doing all the discharge testing, we have completed the first portion of the Nevada newborn screening. This test detects certain disorders before they cause serious health problems. This is a 2-part test. We will provide you with the form to complete the second portion of the screening with your pediatrician. Please do not misplace this form. There is a unique code on here that associates your baby to the results. You will only be notified for positive results. The state will notify you and your pediatrician. Please make sure your contact information is correct on the form. Critical congenital heart disease, or CCHD, testing results will also be listed on your discharge instructions. We checked oxygen levels in your baby's right arm and one on their feet to be sure that oxygen exchange is occurring properly. Follow-up appointments. You will need to follow up with a pediatrician in the next few days. Your nurse and the pediatrician seeing your baby here in the hospital will let you know exactly when you need to make your follow-up appointment. Please let your nurse know if you have not chosen a pediatrician for your baby to see after discharge. You are also welcome to follow up with the pediatrician who has been seeing your baby in the hospital. It is a good idea to bring your baby's discharge packet with you to your first appointment, as it contains information regarding most recent weight, blood type, bilirubin, jaundice level, vaccines given, and hearing screen results, and it also contains the first state health screening. Now let's go over some warning signs from your checklist. For baby, you need to either immediately notify your pediatrician of, return to the emergency room, or call 911 for the following. If your baby has a temperature less than 97.6 or greater than 100.4, both low and high temperatures are indicative of an infection. Remember, your baby has no immune system and will get sick very quickly. If your baby has less than the recommended wet diapers in a day, that can be a sign of dehydration. If your baby has any persistent projectile vomiting, if your baby has any persistent diarrhea or watery stools, if your baby is refusing to feed or misses more than one feeding, if your baby is very irritable and cannot be consoled despite feeding, changing, burping, rocking, if your baby is limp and or blue, please call 911 immediately. Please make sure that all visitors are healthy and wash their hands with soap and water. Do not expose your baby to smoke. Lastly, please do not take any of the baby shirts, washcloths, and blankets from the crib in your room. Let your nurse know if you need an outfit and or blanket to bring your baby home in. We are happy to provide them. Now let's talk about moms. Let's go over your diet. Your body has been through a lot in the last few months, and especially the last couple of days. You've had lots of fluids and hormones shifting. Adequate nutrition is important for your body to heal. High-fiber foods like fruits, veggies, and bran, and foods rich in calcium are important. Things like milk, yogurt, green leafy veggies. Make sure you're drinking plenty of fluids, water, juice to keep yourself hydrated. Breastfeeding moms need an extra 500 calories daily more than pre-pregnant women. Avoid constipation. Make sure you use an over-the-counter fiber supplement, stool softeners, and laxatives if needed. Let's talk about activity. Gradually increase your activity until you feel like you're back to normal. Make sure you're resting frequently. It can be difficult with other children to care for. Lean on family and friends if possible. No lifting, pushing, pulling, anything heavier than baby in the first few weeks. Walking is encouraged. Your doctor will let you know when you are cleared for more strenuous exercise. C-sections cannot drive until cleared by the doctor, and you're not taking any narcotic pain medication any longer. Now let's go over breast care. Your breasts and nipples may have changed and grown in size during your pregnancy. A well-fitting supportive bra day and night may be more comfortable as you adjust to these changes. If you are not breastfeeding, wearing a bra is important. Refrain from stimulating your breasts or nipples. Do not hand express, pump, or allow your baby to feed to alleviate any fullness or engorgement, as this may promote further milk production. You may need breast pads for any milk leakage. You can apply cold compresses every hour for 15 minutes at a time to help with discomfort. Do not apply cold compresses to bare skin, as this may cause injury. It may take a few days to a week for milk production to cease. If you are breastfeeding, a well-fitting nursing bra will make you most comfortable. Nipple cream or rubbing express colostrum after feedings on the nipple can help with nipple dryness. It is important for the health of your breasts to have your infant feed from both breasts at each feed. If they don't, be sure to alternate which breast you start feeding with. Baby should be lined up with your body, nose to nipple, in order to promote latch. Baby should have a wide open mouth as you latch. Your baby's mouth should form a tight seal. Lips should be splayed out against the areola, not the nipple. If your baby is suckling incorrectly, slide a finger between your baby's lips and your nipple to gently break the seal and try again. So how long should a baby nurse? as long as the baby wants. This is usually from 10 to 30 minutes per breast. You should feel a gentle tugging at the nipple, but no pain after the first few minutes. If you do feel persistent pain beyond a minute or two, it may mean that your baby is not positioned properly. Signs of good nursing are as follows: hearing your baby swallow without any clicking sounds, seeing movement above the baby's ears, and not seeing dimples in your baby's cheek. It is good to rotate nursing positions to promote complete breast drainage. If you feel as though you need further assistance with breastfeeding outside of the hospital, please contact your insurance company and visit the Southern Nevada Breastfeeding Coalition website. Now let's go over hygiene and incision care. Please make sure you're washing your hands frequently, changing your pads frequently. Take home the provided plastic squeeze bottle to clean your bottom front to back to prevent infection in these first few weeks after delivery. If you had a vaginal delivery, you may shower normally. Any stitches you have will dissolve on their own. Avoid baths, pools, and spas until your doctor says it's okay. If you had a C-section, generally you can shower daily. Avoid baths, pools, spas, or any type of submerging of your incision until your doctor clears you. If you have any type of wound closure device, please ask your doctor for instructions on showering. Pat the incision completely dry before getting dressed. It is important to look at your incision daily. You may need to lift your belly somewhat to see your incision. If you're still unable to see, use a mirror or have a family member or friend help. Make sure the incision is not red, swollen, starting to open, or draining anything. If you see any of these things, please notify your doctor as soon as possible. Now we'll go over bleeding. Vaginal bleeding should gradually decrease in amount and color and will get lighter over the next couple of weeks. Any heavy bleeding, meaning you are soaking a peri pad side to side and front to back, or if you can squeeze the soap pad and blood would come out, or if you notice any blood clots bigger than an egg, you should report this to your doctor as soon as possible. Everyone is different as to when their menstrual period will come back. It can occur as early as 6 weeks to 2 months after delivery. However, this can vary widely with breastfeeding and birth control use. When it comes to sexual activity and birth control, pelvic rest until you're cleared by your doctor is suggested. This means no sex, no tampons, no douchey, hot tubs, or sitting in a bathtub or anything else in your vagina, even if you had a C-section. Everything needs to heal physically and emotionally before resuming sexual activity. It is Nevada state law for your doctor to speak to you about short and long-term birth control options before you are discharged from the hospital. If they do not, please ask your nurse. Pelvic floor health is important. Pregnancy and childbirth can weaken the pelvic floor muscles, causing you to leak a few drops of urine when coughing, sneezing, or laughing. Doing Kegel exercises a few times a day can help strengthen your pelvic floor and lessen these symptoms. Shaken baby syndrome is a very serious matter. Babies are a great joy to their parents and those who care for them. Crying is how babies communicate their needs. Infant crying usually begins to increase at about 2 weeks of age and peaks at 2 months and gradually should decrease in the months that follow. Some babies cry more than others and for no apparent reason. If you find yourself getting increasingly frustrated with crying after attending to their needs, stop. Gently put your baby in their crib, playpen, or other safe place and walk away for a short time. It is never, ever okay to shake a baby. It is okay to step away right away and calm yourself. For further information on how to cope with a crying baby, you can visit www.don'tshake.org. Postpartum blues and depression are common. Many new moms experience postpartum baby blues after giving birth. This commonly includes crying spells, mood swings, sadness, anxiety, feeling overwhelmed, irritability, and difficulty sleeping. If these increase, please contact your physician immediately. These feelings usually begin a few days after delivery and can last up to 2 weeks. If these feelings persist longer than 2 weeks and are not improving, please speak with your doctor right away. Do not feel like you are alone. These feelings do not make you a bad person or a bad mother. Your doctor can assist with treatment. If you feel like hurting yourself, your baby, or others, please go to your nearest emergency room or call or text 988 or visit 988lifeline.org. Transitioning into parenthood is a major life adjustment. It can feel overwhelming for both mom and partners. Reaching out for support is important if you need it. Now let's talk about smoking cessation. Tobacco and marijuana smoke can be harmful to your health and those around you, including your newborn baby. Please avoid secondhand smoke from you and others when it comes to your newborn. You can find information on quitting smoking at www.lung.org. Any medications your doctor prescribes at discharge will be sent electronically to the pharmacy of your choice. Please confirm with your nurse that the correct pharmacy is on file. Be sure to read the medication information sheets provided by the pharmacy for directions on how to take the medication and their side effects. When it comes to follow-up for our moms, vaginal deliveries generally follow up with their OB in 4 to 6 weeks. C-sections is usually 1 to 2 weeks to check the incision, and then again at 4 to 6 weeks. This may vary depending on your condition. Your doctor and nurse will tell you what your exact instructions are at discharge. It is your responsibility to make your follow-up appointment. Finally, let's talk about some warning signs and symptoms that are super important to call your doctor for. Return to the emergency room or call 911. We are also going to provide you with a magnet for future reference that lists all of these warning signs. Please put this magnet on your refrigerator or anywhere you can refer to it easily. For moms, please call 911 if you experience any of the following symptoms. If you have chest pain, trouble breathing, including shortness of breath, severe headaches, thoughts of hurting yourself or someone else, or seizures, please notify your doctor for the following symptoms. You are bleeding and soaking your pad every hour for less than an hour. Passing large blood clots the size of an egg or larger. Red or swollen leg that hurts to the touch. Temperature higher than 100.4. If you have a headache that does not go away even after pain medicine, along with blurry vision. Breasts that are painful, hot to the touch. If you notice redness or red streaks accompanied by flu-like symptoms, these can all be signs of a plugged milk duct or mastitis. Temperatures greater than 100.4 or feeling cold, feverish if you have chills. Pain or burning sensation, redness, warmth, or firmness in one or both legs. Sharp pains in the abdomen, breast, or chest. Trouble breathing, dizziness, faintness. Difficulty having a bowel movement despite over-the-counter medicines. Unable to empty your bladder fully or to urinate that is painful, difficult, or too frequent. Severe headaches and or blurry vision. Signs of postpartum depression like crying spells or mood swings that feel out of control. Thoughts of harming yourself, your baby, or someone else. To report domestic abuse or abuse, call 1-800-96-ABUSE. This discharge video and your discharge instructions are resources for you so that you have the information you need to care for yourself and your baby at home. At the end of this video, you will see some of the phone numbers and websites we reviewed for you. Feel free to pause the video and take a photo of the listing. Thank you so much for your attention. If you have any further questions, please ask your nurse or your physician. Thank you for choosing Mountain View.